Welcome everyone to another edition of Cancer with Denise, Ejoh. Good afternoon, and thank you for joining us again today. We have been looking forward to having a new chat, and today in the house I've got an advocate survivor who's going to be talking to us. Today we're looking at metastatic breast cancer, the highs and lows of a cancer survivor. Let's look at what we're going to be talking about. Gloria, welcome this afternoon. Thank you for joining me on this nice afternoon for me in England, to be honest with you.
Thank you so much, Dr. Denise. How are you doing?
I'm good. And you?
Yeah, I'm fine. I'm glad to be here. Thank you for having me.
You look very nice. Wow. Let me
Thank
continue.
you.
Alrighty.
Thank you.
Gloria is going to be discussing today her own experiences. So let me introduce her. Gloria is a career program manager, a trained linguist, writer, and breast cancer survivor. She is the program director for Project Pink Blue and a noteworthy patient advocate in Nigeria who has inspired hope in other patients by publicly sharing her story and fervently advancing the case for effective cancer care across the country. Gloria, I'd like to thank you for agreeing to join us and willing to tell your story. I hope that this conversation will be helpful to anybody going through cancer at this minute, family, friends, relatives who need guidance, who need help, who need just to hear from other people who are going through it. We want to thank you for agreeing to tell your story. So let's start this conversation. Are you seated? Are you ready for me? My first question. Please share your story briefly for all of us to know.
I was diagnosed in March 2017, although I noticed the first symptom in August 2016. So before the diagnosis, I'm not somebody that checks my breast. We have all the self-exam. I didn't know anything about that. I wasn't doing it. But that evening, I just touched my breast and something was hard by the side, the left breast. And it took me about 7 months to do different tests, do a scan, do a mammogram. And by March 2017, it was confirmed to be a malignant tumor. And that was how my journey with cancer started. And in the same month, I did a mastectomy. That's a total of the breast. I had to remove the breast totally. And after that, I didn't continue with my treatment. I was referred for chemotherapy and radiotherapy because of all the needs surrounding chemo and, of course, the high cost of chemotherapy at the time. I wasn't working. I was just out of school at the time. And so I couldn't afford it. I couldn't afford the fear. I couldn't afford to go on with the fear. And so I felt, since I've taken out the breast, I'm fine. And about 16 months later, I started having tumors again grow on the chest wall where the breast had been removed. And it caused a concern. And so I had to go back to the hospital, reported, and of course they were angry with me because they asked me to do chemotherapy and I didn't do. And they insisted I go with my treatment. And at the same time, my mom's twin sister had breast cancer and hers was bad already. And related to the family, this place in Ejoh, and doing surgery and convinced me that it was a better idea. All the money I was going to spend for chemotherapy and side effects and all. And I followed to the place. And that was where I had my second surgery. And 4 lumps were removed from my chest again. And I was given herbs to manage myself. But after losing my mom's twin sister, 4 months into her treatment, I began to rethink that decision. So I realized the drugs she was giving, what I'm giving, everything was the same. The treatment, a lot of force, and so I listened at that time, I knew that cancer was not the same. So everybody cannot be treated with so as the flaws with their processes, and I had to go back to the hospital. So exactly 2 years after my mastectomy, I made up my mind I was going to do chemo. I didn't care anymore about the side effects. I made up my mind I was going to raise the money I was going to talk to people. I was going to do anything good to raise the money and just fight for my life. And whatever comes out of it, I was going to accept it. Already I was mourning my aunt, and I had a lot of fear because she even did chemo before she went to. So I had enough reason to still be afraid of chemo because it didn't work for her. But I made up my mind I was going to do everything possible. Thing I did was to talk to people about it. I've always been very vocal about my challenges, and I'm one person that don't pass stigma. And so I started talking to people about it. I spoke to my friends, I spoke to my boss, I spoke to my colleagues, I spoke to everybody, and I requested from people what I think can support me with. And before long, people started raising money for me by this, and I was able to start my chemotherapy and did my radiotherapy. And that was in 2019, 2 years after my mastectomy. And after that, I had a little respite. And in 2022, the cancer metastasized, spread to the hip bone. And at the same time, I still had another cancerous lump on the same chest wall. So I was able to take out the lump from my chest and start active radiotherapy on my legs to ease the symptoms I'm managing. Right now, I'm back on active treatment for the next 2 years. I'm going to be on some medication. And yes, I think that's my cancer story. Let me stop there. No more questions are coming.
Yeah. Wow. Wow. Sometimes whenever I hear the stories of cancer patient survivors, and I think about mine, I always say, well, at least we're still fighting. That makes a big difference. And I think there are quite a lot of people out there that do not realize that fighting is still a good way to keep going. So thank you for sharing that story. Basically, one of the biggest things that you've just talked about is your challenges, right? And bearing in mind all the conversations we've had around all this, let's now look at what your key challenges are with metastatic breast cancer that excludes funding. So we know funding is the big issue. I want to come back to funding.
Okay. So I think I will start from lack of information. So a lot of patients still don't have all the information they need. They don't have enough information. They might not have all, but they should have enough to understand what to expect from their condition and even what they should do. Because in my case, if I know what I know today, maybe I will wait 2 years to start chemotherapy. And because there are so many myths flying around. And these myths come from friends and family, people who are very close to you that can convince you to do things that can be harmful to you in the long run. And then the other challenge we have is the health system as a whole. The health system as a whole is decaying. Like I once said in a Facebook post, I said I'm in an abusive relationship with the Nigerian health system, and I cannot leave this relationship. So a lot is happening in the health system. We have very few oncologists to attend to so many patients. We have over 120,000 cancer patients every year, and we have less than 80 oncologists to attend to them. And these doctors keep living every day. Not just doctors, the whole health workers, they keep living every day. So who are going to treat these patients? And then we have the issue of access to drugs. So sometimes some people actually have this money. They have a lot of money to buy all the drugs they need. The problem becomes getting these drugs. How, getting new drugs. Sometimes some of us use drugs that are not even registered because that is the only one that we can afford. Or that is the only one that is available. And because you are afraid for yourself, you use whatever you see just to make sure. Because sometimes you don't even know when the branded one is going to come. And then sometimes there are no reagents to do some tests, do some screening for you, and you have to wait. So there's a reagent. You have to wait on a long queue to do radiotherapy. And some people have to wait for very long queues to do a mastectomy. So there's a lot going wrong with the health system that is going to affect patients' final outcome. And then there's no MDT. I think the cancer patient should be treated, with a whole team of health professionals. a clinical oncologist, a nurse, an oncology pharmacist, a pathologist, a psycho-oncologist. Everybody should be involved so that they can be able to support that patient in different ways. Because apart from treating the physical symptoms, a cancer patient comes down with a barrage of mental health issues. So who takes care of this mental health issue? So that I think if we get the health sector right, there's of course very few research going on, so many questions left unanswered for patients, very few clinical trials, and very, very few patients having access to these clinical trials. So I think if the health sector itself is put together, it works well, a whole lot will fall in place. So it's actually a very, very big challenge. Yes.
Thank you, Gloria. Thank you. You have highlighted some very concerning issues that I think is good because it opens knowledge in the space, and then we know what we're trying to deal with. So at this point, viewers, we're going to have a break now, and we'll be back in a few minutes. Sit tight and let's continue this conversation on what's going on in the cancer space and the highs and lows of the cancer patient in active treatment. Thank you. Let's take a break here. Thank you, everyone, for staying with us. Now we continue this conversation with Gloria, a cancer survivor who has battled disease since 2017 and is still in active treatment. Gloria, thank you for staying with us and thank you for sharing your story. Let's continue this conversation. Let's continue to see what's going on. Let's see what the highs are. How have you navigated the everyday challenges to ensure you have a reasonable quality of life? Now, I'm going to be very careful when I'm asking you this question. And the reason I'm saying that is that you and I know that with the challenges you have identified, our everyday life, or at least I recognize the everyday life for me as very challenging. And one of the first things I say to people, a lot of people don't know when they see me on screen, is I use a walking stick. So they see this person always smiling and happy, but they don't realize the challenge is much. So now for you in the same seat, how have you navigated every day with the funding, with all those going on?
Okay. Honestly, it's been difficult. So, like you said, when you see people smile, you don't know what is going on in their head. And I've had to manage mental health challenges a lot. The anxiety, panic attacks, depression. Yes, even at some point. And somebody once said that it's not as if you have cancer, you don't have other problems. So you have something as big as cancer with other life problems. So just an extra baggage that is as huge as every other problems of life put together. So it's a big deal, but I try to not allow cancer to dictate everything about my life. Yes, like an author once said that life can keep taking from somebody, but life shouldn't decide how you react to the things life has taken from you. So I make up my mind to be happy. I try to keep working, even when I had a recurrence last year, and my boss told me to stay off work. I told him I can't stay off work. I needed something to keep me engaged, to keep my mind engaged. And so I keep working. I have friends, and I do a lot of fun activities. And I prioritize. I think that is one thing a cancer diagnosis helps people to do, is to prioritize and begin to have more focus on the things that really matter to them and what they really want to achieve. And I've been careful about that. I've been writing more and with a lot of purpose now. So I think these are the ways I'm able to navigate. And then by helping other people, I find satisfaction in sharing my story, because a lot of people don't talk about their experiences. And because of that, many people still think that want to have cancer is an automatic death sentence, because people don't come out to share their story. So I find joy in sharing my story just to give the other person hope. Sometimes people that get this hope or get this inspiration, not even cancer patients, maybe somebody battling mental health issues, maybe somebody badly domestic abuse, and they just come to me and say, "Oh, I just want a bit of your courage to deal with my own specific problem." So I find joy in inspiring people. I find joy in sharing my story. I find joy in doing the things I love to do and be more purposeful about life. There are very bad days, very, very bad days that everything makes no sense. But what I try to do is to quickly push myself out of that place as soon as possible and continue living. I'm here already. I
I
have
want
to
to thank
live.
you for saying that, because when it's very interesting, because when I was talking about this thing at one point, I remember somebody saying to me, "You are not supposed to say mental health challenges." And I was like, "What do you mean? Do you know what it is to wake up in the morning and and have to cry because there's nothing else? You're in pain, or you're looking at the whole world, or you have children you have to worry about, and then you're trying to sit down to
Yeah.
work out how you're going for a chemo treatment, and then you know that that's a whole day gone." And the person looked at me and thought,
Yeah.
"But everything's fine." And I thought, no, because I smile is because I refuse to let cancer sing a song on my forehead. And I'm glad you said it. So at least cancer
Yeah.
patients who are going through it understand that although we're smiling, it doesn't mean we're not going through the same challenges, but we have to learn to navigate. So I hope that has spoken to someone. One key thing that you mentioned, which has really thrown me, and I want to raise it because of funding. I came back, I said I want to talk about this funding. Funding your treatment has been done predominantly by you. However, I do know that you have been able to access at some point the Cancer Health Fund. So I want it to be known that we're not saying the Cancer Health Fund is not available, but you've had challenges with that. So can you share that? Because the people that are supposed to be in charge need to know that there are issues going on with this.
Yes, I've been able to access to get the Cancer Health Fund. I have the form that has allowed me to use the services, but at this time, my treatment I'm on currently have not been tied to the Cancer Health Fund. So as it is, I'm still paying out of pocket. So the drugs I'm taking now have not been tied. I know that radiotherapy, people can do it easily, surgery, some other drugs. But the specific drugs I'm taking right now have not been tied to it. So I just have the form, but not benefiting from it. So, but I've discussed with my doctor. She has assured me they're talking with the company to make sure that we come on board the Cancer Health Fund. But as it is right now, I'm keeping out of pocket.
Wow. So basically, for the next 2 years, you are going to have to be seeking assistance from every Tom, Dick, and Harry, because no matter what we say, the cost of cancer care is very expensive. That's what you're saying.
Yeah.
Wow.
Yes.
Well, hopefully, maybe somebody will watch and want to reach out to you. I really do hope so. Not for any other reason, but no matter what we go through, I do appreciate this story. I'm going to ask you another question. In your journey on this, and this is, I'm trying to close up now so that we tidy up. Society, in my view, has let us down. And when I use let us down, I use the word I don't use it nicely. I use it as a global term. Society has let cancer patients down globally. Society has not been fair to recognize that in 2023 that we are in, over 4 million people have cancer, and more than 50% of them have already died. So before we now look at Nigeria, where our data is only based around those who present in the hospital, yeah, where we have to be factual. Survivors have gone through and are keep going through this challenge. Name, I will name one, and you will name two. And I know one of them, everybody calls it our begging strategy, but I really don't care, right? What do you want to do? What do you want society to do for you and all other survivors, cancer survivors? When I use the word cancer survivors, anybody that has got a cancer diagnosis, for every day you live, you are a survivor. So let's put it, and let's try and be positive about our life. We have survivors and we'll smile. Name one. My own name is going to be financial support. And globally, it has been known that any cancer patient across the world who is not funded because they have family to fund lose their homes and their income within 2 years and join the beggars club. So that one, I would like to see Nigerian government go and relook at their funding thing that they seem to say they are dashing out money, and reflect on going to the cancer centers to see how they can support cancer patients. That's my own take. That's my own want. Give me yours. Give me two. We got 2 minutes and then we're closing up.
Okay. And in addition to that, I want society to begin to provide enough emotional support, psychological support to cancer patients. I noticed in our support group that, that divorce seems to be on the rise for women with cancer. And I wonder why somebody will walk away from their spouse because they have a disease they do not bring on themselves. So I don't know how those women are going to survive. Some of them I know have died, and I'm not surprised because some of them have to go through divorce, battling cancer. So people have to show enough empathy, knowing that tables can turn and it will be them on the other side. So that emotional support will translate to supporting people in any way you can. It mustn't be money. Sometimes somebody's in the clinic, you can go and check on their children, might take that clinic to check on their children, you can wash their clothes, bring them food, take them out to do some fun activities, anything that will just make them forget for a while what their life has turned to is very important. And of course, care support, cancer patients, talking to cancer patients is very, very necessary because it's only a cancer patient that can understand what you're going through and might be able to relate in very clear terms. So that care support is very, very important.
I want to thank you, Gloria, for sharing your story.
Okay.
On a very honest note, it's quite interesting, and I thank you for the solutions and the way you're looking at how we need to make an impact. One of the things I really agree with you is, for instance, I am sorting out Cancer Survivors Day in England, and I'm trying to just get cancer patients, family, and friends to just sit down. Let's just eat, play games, and just be happy, because that's all we've got. We've got to be happy, and you got to learn to be happy. So to all those out there, whatever is going on, no matter how bad it looks, between Gloria and I, we are saying to you, please be happy, no matter how the storms rage. Today is a good day, tomorrow is not a good day. It doesn't mean. Just fight and aim to survive. And to all the supporters, please hang in there. Please. We really, really appreciate you. Gloria, thank you for joining us this afternoon, and thank you for your time.
Thank you. Thank you so much.
Thank you for sharing your story. And I will be coming back to you. As you know, we have to think about where we're going next. We have to go and make noise globally so that maybe some money can come to Nigeria. I don't know. Yes. We just have to do the right thing. You can all follow us on Common Cancer Foundation. You can find us on our YouTube, Facebook, Instagram, everywhere. We're all over the place. Just look for either Dr. Denise Ejoh or look for Common Cancer Foundation. You will find us and you can get information. We've got a YouTube channel. This will be on the YouTube channel once it goes on air, and you will enjoy yourself. We look forward to seeing you again very soon. And thank you for staying with us. Take care of yourself. Bye.